Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. Today I want to briefly discuss the most effective way to cement your primary zirconia crowns using NuSmile's BioCem bioactive cement. BioCem cement is a resin-modified glass ionomer cement. This group of cements have been found to be among the most desirable cements to use for cementing zirconia crowns due to their high bond strength with zirconia. But the proper handling of BioCem is important in order to maximize success. Remember that resin-modified glass ionomers are dual-cured cements. The set of the resin portion of the cement is activated by light curing, but then there's also an acid-base glass ionomer reaction that occurs as well. BioCem cement comes as a double tube syringe with disposable auto-mix syringe tips that are used to dispense the cement directly into the crown, so there's virtually no waste. When you're ready to cement your crowns, make sure your preparations are clean, dry, and free of hemorrhage. Remove the cap from the BioCem syringe and then slowly bleed the syringe so that both cement components are at the opening of the syringe barrel. Now place a mixing auto tip onto the syringe and slowly express the cement to fill your crown to the desired level. Next, position the crown onto the preparation. You've got about 60 seconds for this positioning step. When you have the crown in position, just allow it to sit on the tooth for about 15 to 20 seconds in order for the cement to come into intimate contact with the entire preparation. Now, after 15 to 20 seconds, use your light to flash cure the crown in place. This 3 to 5 second light activation on the facial and lingual surfaces will hold the crown in place and slightly harden the excess cement, making its removal easier. Next, in order to let the glass ionomer reaction of the cement begin to take place, it's recommended to let the crown sit for at least 1 minute. Now, during this minute, you can carefully begin to remove excess cement with an explorer. During the cement removal, make sure to stabilize the crown with your fingers as you move your explorer laterally, never in an incisal or occlusal direction, as when you use this motion, it's more likely to dislodge the crown because the cement is not fully set. After the excess cement is removed and the minute has passed, finish curing the cement with the light for at least 10 seconds on the facial and 10 seconds on the lingual surfaces. When the cement is fully cured, go back with your explorer and recheck for excess cement. Now at this point, I always use knotted floss interproximally to ensure that there's no leftover cement between the teeth. I avoid using the floss after that initial 5-second cure because I'm afraid it may dislodge or move the crown before it's fully set. And here's something that's really important to know. If your crown moves after that initial flash cure, it will not rebond well to the tooth. So if it moves after that 3 to 5 second flash cure, I recommend that you just go ahead and remove the crown, remove the cement, and begin again. When you follow these steps, place the crown and let it sit for 15 seconds, flash cure 3 to 5 seconds on the facial and lingual, let the crown sit for at least 1 minute, and then do a final cure for 10 seconds per side. You should have a very well bonded crown. Now, you're probably saying, that seems like a lot of time for me to sit and do nothing. However, when you're cementing multiple crowns, you're almost always doing something on one crown while another is sitting and curing. So there's actually very little wasted time. When you're all done, don't forget to remove the auto mix tip from the syringe and recap the syringe. As with any material or product, following the manufacturer's instructions usually leads to optimal results. NuSmile's BioCem bioactive cement is no different. It's a great cement, but it needs to be used properly. Well, that's all for now. Thanks for listening, and I'll see you next time.